Hi, my name is Alyssa Tooley and I have multiple chronic illnesses. This whole process of multiple chronic illnesses began when I was in 3rd grade and I got diagnosed with gastroparesis, which is delayed gastric emptying. And so basically when you eat food, the food just sits in your stomach for hours upon hours and it takes forever to digest. And so this causes like stomach pain and just acid reflux and vomiting, and it just is really painful disease. And so being a 3rd grader, it was hard to deal with, but time went on and 5th grade began and I was having more issues than just those symptoms before. And so I started having chest pain, more acid reflux than usual, and then just burning sensation throughout my esophagus. And so I had to go back to my gastroenterologist and she diagnosed me with eosinophilic esophagitis, which is a disease where depending on what food you eat, your body will react differently, and white blood cells or eosinophils will attack your esophagus if you're eating food you're allergic to. But the problem was I didn't know what I was allergic to, so I continued to eat things that would make my esophagus attack itself. And so it was really painful, and so I had to start a lot of different treatments to start to see a decrease in my pain, because being like 10 years old, I was in a significant amount of pain, going to the hospital a lot, and it just was abnormal for a 5th grader to go through. During freshman year, I had to go to Mayo Clinic, which is in Minnesota. It's one of the best clinics in the nation, just to see if there was something else that was going on that they were not seeing at home. And so there were signs of Crohn's disease and eosinophilic gastroenteropathy, which both are more severe than irritable bowel syndrome. Crohn's disease, a lot of people have heard of that, but it's just an autoimmune disease where your colon and your small intestines basically just attack itself also, but it causes like really bad diarrhea and just more symptoms that are not fun to talk about, but still occur, and then just extremely bad pain. It can cause weight loss and just symptoms that are more severe than irritable bowel syndrome. And so they were leaning more towards Crohn's disease, but I never got the full diagnosis of that. And so they said that irritable bowel syndrome was a misdiagnosis, but they don't know what the actual diagnosis is. So my parents realized how horrible my pain was getting again, and so we decided to go back to Mayo Clinic. And my 2nd time back, they still didn't figure out anything wrong with my colon. They know that it's not irritable bowel syndrome, but they know that it is an autoimmune disease that they think has not been discovered yet. So that is really discouraging because the disease hasn't really been discovered, so they don't have any treatment for it. And they didn't figure out any way that I could manage my fibromyalgia. They didn't really give me any answers. So it was difficult coming from that, because now I'm here and I'm still in a significant amount of pain, but I just have to stay strong and hope for the best.
So what activities do you do to keep your mind off of the fact that you do have these illnesses?
Well, some coping skills that I've been given through like therapy and stuff is I definitely write a lot. I write how I'm feeling, and it just gets the emotions out without actually like talking to people. But talking to people is a really good thing too, because you just get to express like how you're feeling, and they can just give you advice on how to get through the day, and just tell you that everything's gonna be okay. And just wait, what was your question? Gosh. But I also box and do yoga and all those different exercises so I can manage my chronic pain, and also just going to church and keeping my life focused around Christ just really helps me.